started explaining to me, what is this lifestyle medicine? He said, we write a prescription, there's no medicine. So I said, so that's how I came down. When I came back to Pakistan, budget was not announced then. So I, in PSDP, have made a project, I created a project called Lifestyle Medicine Project and tried to put some money in PSDP. Although it was not accepted, and all my new projects were just slashed down under the economic cut. But had that been approved, there would have been, for the federal government, would have just had one project in PSDP that's called lifestyle medicine, and we had some plan. And then during that, when I was like getting more education about that, I read your beautiful article, Dr. And that article mentioned Dr. Shagufta. So I spoke to my DG and my people that get connected with Dr. Sab. I don't know. Then you were gracious enough, kind enough to provide all those details and narrative about this whole lifestyle medicine. And then somehow we found Dr. Shagufta. We explored her and reached out to her, and we had a video conferencing meeting. I could not travel to Lahore, Dr. Sahib. I would have just loved to be there in your institution and meet you in person. We had a detailed meeting. What is this to me to be very? Why I would send it? I can't. Sorry to say, but I can't do things which doesn't appeal me. There's no gray area in my life. It's black and white. Either I do it, I don't do it. This is like, it's in my heart. I want to do. I want to be part of this. I want to do. Why I'm saying it? There are two reasons. As an administrator of health in Pakistan, there's a problem. It's a collapse system right now which we are having, and we don't know what to do. Why? Why I'm saying that, you go to PIMS hospital, when you visit the tertiary care hospital, it seems like there's a public rally has just ended here. A jalsa. Koi political jalsa khatam hua hai. A flood of people are coming in, a flood of people are going out. How on this earth any administration would be able to satisfy these many people? Average doctors working hour, within that working hour, he's supposed to see 30, 35, 40 patients a day. He is looking after 280 patients, the patients in a day. More than that, how on this earth you will be able to handle all these things? And then 70% of those people who are going to the tertiary care hospital, they are not supposed to be there at the first place. They should be going to the primary and secondary. Just because those primary and secondary is not there, so they all ended up hitting to it. So that is another issue. But as a whole, this 240 million people we count on the paper, we are more than that. 6.13 million babies are coming every year. We are more than an El Salvador's population coming. We are beating them every single year. El Salvador is not known much. So I give an example of New Zealand. New Zealand, we have left New Zealand far behind, by the way. So every single year we are adding up one New Zealand in our country. So, and this thing is, and yet we call this polio vaccine as the virus which have the infertility problem. Where is the fertility problem in Pakistan, right? I wish there was something. It's not. It's working other way around. And anyways, that's. So I was why. So I have come. I'm not a doctor, so I didn't know this subject before much. So I kept quiet 2 months. I just listened to the people. I just observed, and then I came to that conclusion. This is a collapse system. This is not. When we call healthcare system of Pakistan, of any country, healthcare includes And to me, healthcare is allowing the environment not for the people not to fall sick, prevent them not to fall sick. It starts from the birth of the baby, the vaccine you then provide, the water you drink, and so on and those things, which you were mentioning. All these things included. That is the healthcare system of Pakistan. Right now, today, for last 7 decades, what we are doing, we are building hospitals under the healthcare system. We are bringing doctors, paramedics, this and so on, so on and so forth, and then we wait for the patient to come. So it's a sick care system of Pakistan. It's not the healthcare system of Pakistan. Healthcare starts out of that hospital at the street. I mean, mayor of Karachi, so 178 facilities used to health facilities used to come under me. So getting an interaction with the doctors have been like a long back phenomena, not new. So they used to say 70% almost diseases are the waterborne diseases. That's what doctors say. Right? So 70% diseases are the waterborne diseases. So what is the condition of our water today? You have mentioned many things, Azan Saab. Today, if I just look at it, a very first neighborhood there in Gilgit-Baltistan on the top of mountain, when they flush their sewage, that sewage of that neighborhood come out from that area and gets connected to someone's drinking water. The next mohalla, the next neighborhood, then they flush their sewage, it goes to the another clean drinking water, because there's no sewage treatment concept. The chip is not there in this nation. Unfortunately, I fail to understand. हमारे यहाँ sewage को treat करने का concept ही नहीं है. So it's contaminating all the way from Gilgit-Baltistan till Karachi with each other's sewage water. Yet we call the 70% diseases are the waterborne diseases. The authorities which give the permission for any house or any neighborhood, any real estate to emerge in that area, would they look into it? They have the checklist that whether they will provide the water or not, they will provide the electricity or not, they will build a school, madrasas, mosque, road infrastructure, garden, parks, so on and so forth. Have they ever looked in that neighborhood whether they will have this sewage treatment plant for the discharge sewage or not? No. Not even single neighborhood housing scheme have been disapproved, but by not having a sewage treatment plant, and yet there's no problem. And I mean, it's not in our chip, in our mind. We're not doing anything wrong. So how would on this earth you will be able to take care of each and every soul who falls sick and then you provide the health facility? No, that's not possible. I'm saying as a minister of this state, no, it's not possible. Sorry, it can never happen. We will always be there will be always be in a shortfall. No matter how many bricks and mortar structure you build in this country. It's not even on every single street. If you have on the corner of a street, you have the hospital. That hospital will become obsolete for the very first day, and the same bickering will be going on. So we have to take a breath, hold on, wait, and think. Where are we heading? What's going on? And just let's not be superficial, be there with a superficial and very cosmetic kind of solution. So to me, healthcare is allowing people not to fall sick. This is like an admin. So that's where the prevention and the primary care and so on and so forth. That's one area. And what are the second area? And that has got something. I'm just narrating here my interest. What has got my attention towards that. And the second part is the belief. I believe that we as a human are the product of Almighty Allah Ta'ala. We are the product. We are the product. Like this cell phone is a product of someone. This camera and so on and so forth, everything is a product of someone. We as a human being, we are the product of Allah Subhanahu wa Ta'ala. And Allah, when created this product, has sent a manual as well, how to use this product. Like you have the cell phone's manual, like you have the TV manual, like you have the fridge AC manual. If you use the wrong button in it, it will hang. So divine asks us to sleep. The time he sets us to sleep, we get up at that time. हम तो कराची के लोग रात के 12 बजे उठ के जा रहे हैं जो है वो खाना खाने, रात के 2 बजे खाना खा रहे। इम्प्रेस मार्केट है कराची में, दोपहर के 2 बजे खुलती है, दोपहर के 2 बजे, when 60-70% काम हो चुका होता है, और रात के जो हमें is India asking us to do that? Conspiracy theory? इजराइल कह रहा है हमें करने के लिए। हमसे बड़ा हमारा दुश्मन कौन है कुछ चीजों में? So that's the bagawat against the divine. This human being, this product is going against what Allah has decided and defined for us. I have heard all the almost speakers spoke about this. To me, that's a belief thing. So this lifestyle medicine is bringing a human being, this product, close to the nature. To me, it's bringing a बागी इंसान जो कि बगावत कर रहा है, सुबह उठने का टाइम उसके कुछ और है, उस वक्त वो सो रहा है, रात के जिस वक्त जागने का टाइम है उस वक्त सो रहा है, जिस वक्त उठने का टाइम, जिस वक्त खाने का टाइम है कुछ और कर रहा है. So it's all bagawat going on. It's all rebelliousness going on with the Creator. So this is, to me, is bringing that product, the creation towards the divine, closer to the divine, and closer to the nature. And the more will come closer to that nature, the long lasting this product will become. This is how I take it. So, PMDC's president has, I was told, was here before me. When I stepped in, I had few things in my mind. Almost everything has been said and agreed before I came to this place. I need an one pager, Dr. Sahab. The one pager, not many English in it, pointers. One pager out of, I wish 3 दिन आप लोग यहाँ पे रुकेंगे. I wish I knew it, before. मैं सारा कुछ schedule कर लेता and I would have been stayed here with you, 3 days here. But my traveling and all is not doesn't allow me to. तो मुझे नहीं पता था ये सारा कुछ. So we are very open. Very open, everything can be done. This must be integrated. This lifestyle medicine, which you all have initiated, you all the pioneer, it has to be created in the healthcare system and education of Pakistan. And this has to be done. It's not you are saying, it's my request to it. And for that, we will do anything and everything to co-op with this, to co-op with this. And I'm so glad all these things are coming from the doctors. Had it been someone else, वो कहते क्या दरिया उसी बातें कर रहे हैं, साइंस तो ये नहीं कहती. And I'm so glad. So that's how I feel this is workable and doable, because it's coming from you all who have got the knowledge of this field, from enormous knowledge, and coming this from you, that has an importance. It's not coming. This is not coming from किसी बुजुर्ग से नहीं आ रही है, किसी हकीम साहब से नहीं आ रही है, you understand the limitation of the society. So even no matter how good those things would have been, I'm not saying कि उनके पास से चीज आती तो गलत आती, but मैं कह रहा हूँ कि the resistance would have come from your fraternity. Today it is coming from you, so this is more viable for us. And trust me, this is I'm not here to please you and to anyone. This is the way forward. This is the healthcare system of Pakistan would be. So I'm not interested in making any hospital. देखिए hospital सियासतदान लोग सब आप the president सर और आप जो है वो रहे हैं उस जगह पे आज अभी इसकी तो कोई कवरेज नहीं है, कुछ समझ में भी नहीं आएगी बहुत ज्यादा, लेकिन एक मैं 4 कमरों का हॉस्पिटल बनाऊं ना और कल जाके फीता काटूं उसका, तो जो है वो अगले दिन हेडलाइन है उसकी, 4 घंटे खबरों में खबर चलेगी. तो बेसिकली पॉलिटिशियंस आर इंक्लाइंड टुवर्ड दैट. और वो चूंकि डेफिनेटली अच्छी चीज़ों को आप रिकग्नाइज करते नहीं क्योंकि बंद कमरों में होती है, उसको भी पॉपुलैरिटी चाहिए, उसको भी पब्लिसिटी चाहिए, पता चले कि क्या काम करा. मेरा मसला नहीं है ये, दैट्स नॉट माई प्रॉब्लम. मुझे नहीं करना, मुझे नहीं चाहिए. तो हॉस्पिटल बनाने में मेरा कोई इंटरेस्ट नहीं है कि हॉस्पिटल बना. मैं ही नहीं कर रहा हूँ, नहीं कर रहे, नहीं करेंगे, बंद कर देंगे, करेंगे, कर रहे हैं, but that is not resolving the problem of the people. So this is the clarity, and that's not me. We have been talking to ministry. पहले तो आपको अपने लोगों के दिमाग को ठीक करना होगा. तो I have been advocate, the biggest advocate I have been having, and alhamdulillah, everything with everyone there who were the decision maker on a same wavelength right now. Right, like I said, they had kept this this project in the PSDP. Unfortunately, we didn't get the money, didn't get it approved. Any project didn't get approved actually. So this is the way forward. We need to see our hospitals, private hospitals, government hospitals, doctors educated and trained with the lifestyle coaching and all these knowledges. And in our education as well, education, all medical education is under the ministry, which is under the Pakistan Medical and Dental Council. That's where we have to inculcate, that's where we have to integrate this whole mechanism, so that the upcoming generation of Pakistan's doctor, they should be well equipped, so that at the end, with this result, we will be able to educate people to take care of themselves, not to fall sick. We would be able to go on that primary and secondary and then the prevention, so that all these things, the menace which we have today, this could be minimized, and at the end of the day, it could be controlled. Today, WHO tells us 13 million people have gone beyond the poverty level who were not poor before, just due to these health burden, disease burdens. 1,30,00,000 लोग गरीब नहीं थे, गरीब हो गए बीमारियों की वजह से. उनके घर बिक गए, उनकी जमीनें बिक गई, उनके जेवर बिक गए. And this situation is not stopping anywhere. अल्लाह के रसूल सल्लल्लाहु अलैहि वसल्लम की हदीस है, मफहूम अर्ज है, मूसा अलैहिस्सलाम को अल्लाह ताला ने बोला कि दुआ मांगो, कुछ मांगो. तो मूसा अलैहिस्सलाम ने अल्लाह ताला से पूछा कि रब आप ही बताएं क्या मांगो. तो रब ने कहा कि सेहत मांगो. अल्लाह के रसूल रब ने कहा सेहत मांगो. Allah wants us to take care of ourselves. Sehat is such an important thing. But these things, I would say, at the end, Dr. Sahab, it should come out of these hotels and these conferences. It should be talk of the country. It should be, because you are talking about 240 million people, each and every soul, and every year 6.13 million. Don't forget this. 6.13 million are coming every year. So you are talking to each and every soul who lives here. So it should be the talk of the entire country. How this gap could be bridged, I don't know. But we have to sit together. That this will become a norm. Everybody must be talking. I would request the media, I would request the entire journalists and everyone, all the influencers, that take this cause as a national cause. Take this understand, and it's very simple and easy to understand, and be the voice, to be vocal on this issue, to just create this awareness in people, that no, this high fancy big hospitals are not the solution. Solution lies within the house, within the street, within themselves. So these words, Dr. Sahab, thank you so much for bringing here, and I'm so grateful and wish you all the best. More shukriya. Pakistan.